Thank you, everybody. Good to see you this afternoon. Good to be back at the American Telemedicine Association. For those familiar with the teleradiology, really was the first medical specialty that really had a, in terms of telemedicine, teleradiology really was the first commercially accepted specialty. Telemedicine industry has burgeoned. There's never really been a connection between teleradiology and telemedicine, perhaps until now. There are many reasons why somebody would want to get a second opinion. If you talk to the folks up at the Mayo Clinic, you ask a doctor a second time on a particular diagnosis, often you're going to get a, you're not going to get the same opinion that was gotten the first time. Doctor doesn't always get it right, and sometimes you need the opportunity to access a specialist. You don't always have the ability to easily communicate with a doctor. You may get a diagnosis, but you may not have the ability to go and discuss with the doctor that particular diagnosis or why they're telling you what they're telling you. Sometimes it's actually a doctor that's recommending that you get a second opinion, especially for a difficult diagnosis. And many times there are abnormalities which are not noticed during a first review. So what we're offering is the ability for a patient to be able to get a professional second opinion from a radiologist. When they have the initial imaging exam, we're asking the patient to remember to ask for a copy of the image. It could be a CAT scan, an MRI, a mammogram, or an ultrasound, but the imaging provider must provide a patient on request with a copy of that exam. Most they can charge you for might be $5 for the CD, but you're able to bring it home. We would then have the patient identify that they're looking to get a second opinion. They're sent a form to complete where they're asked for the reason for the second opinion. The patient then is going to upload their exam to the system. We send to our radiologist, and within 24 to 48 hours, they will get in English a written interpretation of that exam. Then it's up to the patient to decide what it is that they want to do with it. Oftentimes it may confirm the diagnosis from the original physician. It may be something different. At that point, they may need to seek additional medical opinion, but they have now, received a, qualified radiologist offering them with a second opinion. They're going to be charged a fee for the service depending on what the modality is. It's a competitive fee, but what they're paying for really sometimes is peace of mind, or paying for really a instruction of what do I go do next. It may be being done in support of a family member, but it's a fairly reasonable fee, for that peace of mind in terms of the interpretation. The company that is providing this service, it's called Teleradiology Specialists. It's a group of 100 U.S.-based, board-certified radiologists licensed in all 50 states. The group has been in existence for about 10 years. They're the largest provider of off-site radiology reading for the urgent care industry. Last Monday, they broke their own record. In a single day, they read 10,000 x-rays for 2,000 urgent care centers, and their doctors do have the ability to read, all modalities. So it's a qualified group of doctors, doctors that are, anxious to be able to support patients in some additional ways than what they've done before. And for anybody looking to get access for the service or looking to get additional information, I'm the one that you want to talk to. It's a pleasure to speak to you today and happy to answer any questions.
I have a question. So I was in Canada and I got something like this and they charged me only $50. Why do you think it's so much more expensive in the US?
What was the modality? What type of
X-ray CD.
Could have to do with the licensing requirements of the doctors. Healthcare sometimes is more expensive in the U.S., but were you satisfied with the results that you got?
Very much. Yeah, it was fine. All right.
There's some medical care. It's sometimes hard to determine where the value is. The greatest proportion of the expense for us is paying for the doctor's time. So my suspicion is that a radiologist in the United States probably is getting a little more than that radiologist in Canada.
I understand. Thank you very much. Thank you very much.
Thank you.
Reis.